This class is about posterior palatal seal. It is a soft tissue junction along the hard and soft palate on which pressure within physiologic limits can be applied to aid in retention of upper denture. The peripheral seal of a maxillary denture is an area of contact between the mucosa and peripheral polished surface of the denture base, and this seal prevents passage of air between the dentures and the tissues. The retention stability of a denture is achieved with the help of adhesion, cohesion, interfacial surface tension that resists the dislodging forces that act perpendicular to the denture base. So, adequate recording of posterior palatal seal area help in resisting the dislodging forces on maxillary denture base, thereby enhancing retention. Coming on to the functions of posterior palatal seal, it helps in stability, retention, compressibility, comfort. It also helps in resistance to horizontal forces, and it helps in compensating polymerization shrinkage, and it helps in preventing gag reflex because the seal is adequate and thereby enhancing comfort to the patient. PPS area anatomic considerations, it is divided into two: postpalatal seal and pterygomaxillary seal. The postpalatal seal extends from one tuberosity to the other, and this pterygomaxillary seal extends from the pterygomaxillary notch continuing for 3 to 4 millimeters anterolaterally, approximating the mucogingival junction. It occupies the entire width of pterygomaxillary notch. This pterygomaxillary notch is covered by the pterygomandibular fold, which extends from the posterior aspect of the tuberosity to insert into the retromolar pad. This fold of tissue influences the posterior border seal if the mouth is wide open during the final impression procedures. Fovea palatini are two glandular opening within the tissue posterior of hard palate lying on either side of the midline and used as a guideline for location of posterior palatal seal area. Mid-palatine raphe, which lies over the median palatal suture, contains little or no submucosa and cannot tolerate compression. That is why this is considered as a relief area, and that is why the shape of posterior palatal seal is in the form of a cupid's bow because of the extension of the posterior nasal spine. Now, coming on to the vibrating lines, the imaginary line that crosses the posterior part of the palate, marking the division between the movable and immovable tissues of the soft palate, which can be identified with the help of a T-burnisher, discriminate the anterior and posterior vibrating line. Anterior vibrating line lies at the junction between the immovable tissues over the hard palate and slightly movable tissues over the soft palate. Now, for recording the anterior vibrating line, we ask the patient to say ha in a short or exaggerated manner for due to the projection of the posterior palatal seal. Now, this anterior vibrating line can be recorded even with the help of a Valsalva maneuver. Now, for posterior vibrating line, it is an imaginary line at the junction of the aponeurosis of tensor villi palatini muscle in the muscular portion of the soft palate. Now, this can be recorded by asking the patient to say ha in an unexaggerated plain fashion. The presence of thick ropey saliva may create a problem for maxillary denture as it increases the hydrostatic pressure in the area anterior to PPS, thereby resulting in downward displacement of upper denture. As I said before, these are the techniques which are shown in the slides for